From the station that's on your side, this is Channel 7 News Daybreak.
Well, welcome back. Do your plans for 2023 include becoming pregnant? If so, there are some things you should consider before having a baby, and there's no one better to ask than Baptist Health OB-GYN Dr. Brian Burton, who is joining us this morning. So, Doctor, thank you so much for being here.
Thank you. Absolutely a pleasure.
Yeah, so for couples or women who want to have a child, what are some things that they should consider before getting pregnant?
I think the key there is before. It's always super important to talk about getting pregnant before you do. Half of pregnancies are absolutely unintended, not necessarily unwanted, but unintended.
Okay.
And if you can address some of the things beforehand, it makes a huge impact on pregnancy outcomes.
So what kind of things should you plan for or think about, prepare for?
Yeah, so medications are always a big question, right? A lot of people take medications for mental health, for blood pressure, for diabetes, for vitamin supplements, all the things. And to talk about those medications with an OB prior to becoming pregnant can dramatically affect things.
Because we know that women who are pregnant can't take a whole lot of things, right?
That's right. I read this statistic that only 30 medications are actually proven safe during pregnancy, and 98% of pregnancy or of medications are unknown.
Right.
So we all have patients that we follow for different reasons, and they're on medications for different reasons. Mental health being a huge reason women take medications.
Right.
Depression, anxiety. The bill that's been introduced to talk about postpartum depression.
Yeah.
What better way to control postpartum depression than address it through the whole pregnancy, right? And so talk to your doctor about those medications.
Yeah, for sure.
Yeah.
And what are some things that should be stopped right away, like smoking, for example?
Oh my gosh, smoking for sure. And people think that smoking cigarettes is the only bad thing, but what about marijuana? What about vaping? Both of those have been shown to be detrimental to pregnancy as well. So exercise, obviously, it's the one thing that doctors always talk about because it's the one thing that's been shown to make a big difference. And being on a Mediterranean diet for 3 months prior to pregnancy, I read a study that showed a 40% decrease in adverse events.
Really?
For 3 months of a Mediterranean diet.
And so talk about exactly what a Mediterranean diet is for people who've never heard of it.
It's the healthiest diet in the world, and it's olive oils and beans and lemon and just vegetable heavy. Protein is typically derived from beans, etc., as opposed from meats, right? So very little red meat, high fish, salmon, shrimp, that kind of thing.
Getting all those healthy fats from fish oil.
From fish oils, absolutely.
And, well, that's interesting to know.
I know. I was kind of blown away by that statistic on that study.
So unlike me, who ate SpaghettiOs and peanut butter and jelly sandwiches, don't do what I did, because I gained 50 pounds with both of my daughters. 50 pounds, it was a lot. So
you know, the thought is that you can't have any cravings. And I tell my patients all the time, like, oh my gosh, that's stupid. Enjoy your cravings.
Sure.
Just from an overall standpoint, be better. Nobody's perfect.
Maybe not just eat only your cravings like I did? Okay. And real quick, folic acid. Let's talk about, is that important or is that just a myth?
It is. And you can reduce neural tube defects, which is spina bifida, cleft lip, cleft palate, those defects that we've all seen. You can decrease that by 40% if you take a supplement 3 months prior to pregnancy that contains folic acid.
Now, and is that in those prenatal vitamins that we get?
Usually.
Okay.
Usually it is. Most prenatal vitamins have that. I mean, I don't know any off the top of my head that don't.
Sure.
But just be aware. Pay attention.
All right. Well, there's lots to think about. It's a big decision if you're going to make it this year, and we certainly thank you for all of your advice, Dr. Burton, with Baptist Health. And you can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.